There we go. We're live.
We're on.
I'm going to go get Instagram on. Wait, here we go. Forgot how to do it. You can keep talking.
Where are we live right now?
This is Instagram for the first time.
Yep.
And so we are live from Facebook, YouTube, and Instagram.
All right, perfect. All right, I'm Dr. Tim Peck. This is Sarah Blessing, my co-founder here at Project Next Media. We are creating this media company to free us from the fear and hate that the national media gives us and rise above the fact that we don't really have local media to give us stories. So we're giving you these kind of hyper-local ways of looking at the world and finding things that can make your life better.
And when we do have local news, it tends to be very high-strung, high-anxiety things that you're having to see. And I know I can't honestly handle too much of it.
Right.
So
we're looking to be solution oriented. We're looking to help you, to interact with you. Please give us your comments and we'll try to do it in real time, but also afterwards. And we are looking to be positive. We're looking to say, this is the way the world looks right now. It might not look that great, but it could look better.
First thing once anybody's on is we want to ask about sound, if sound is okay. We're trying out some new things. We've been having some crackling. And then when I tried again, no crackling, but it was too quiet. So let us know about sound. Doing it live is something most shows don't do. So in doing something differently, we're having to troubleshoot some issues. So let us know if the sound is not great.
All right. And so we're going to have programming at Project Next. These video casts that we do right now are more just getting our voices together, getting a population of people to come follow us. Hey, Laura.
Laura, can you hear us okay? Thanks for joining us, girl. Keep talking.
Starting to get the following together as we get the underlying platform together, which will take, a few more weeks. Thank you, Laura, that you can hear us.
Yay!
And until we have a real kind of slate of programs. One of those programs is going to be called Dr. Tim.
Yes.
And
that's the show we're trying today. First time.
That is the show. The premise of that show is that people say the healthcare system is broken. And I actually don't believe that it's broken. I believe that it was designed very poorly. And those two things are different. If something's designed poorly, that means we can redesign it. That means we can change it. That means we can change the actual rules so everything that's built off those rules can be better. And the way that we're going to do that is by talking to individual people who have experiences with healthcare, which is pretty much all of us, right?
I am a normal person. I do not understand healthcare. I've heard you talk about it before, and when you talk about it, I understand it. So I'm very thankful that you're going to do this show. You want to make it interesting. So talk to real life people who have had medical things and then explain what we don't get in ways that we understand. I am not a doctor. I also don't work in healthcare. I don't understand those documents. I don't understand the billing. I just know what I have to pay. There's a lot of things I don't get, and I appreciate that you are going to try to explain them to me so that I can understand them and so you guys can get it, because all of us go to the doctor. All of us have medical procedures. Our family, our friends, we're all struck by this problem of getting the right care, and then we are all terrified of the bill to come after.
And so the question is, why do you sit in a waiting room only to sit on a table on some white crinkly paper with a gown with your butt showing and feel dehumanized and have to wait for a nurse to come in and then have to wait again for a doctor?
Right.
What is this system? This is in no way something that's user friendly.
Right.
How did we get here?
Yeah.
And then how do you not know how much you're going to pay before you go to the doctor?
Right.
Right.
I wish that I could just say, about how much is this going to cost? Since I had surgery last Thursday, I feel pretty blessed because my husband, we have 5 people in our family. And when my husband signed up for the healthcare plan last year, he goes, I'm going to go ahead and get the most expensive plan with the best coverage, because who knows if something's going to happen to one of us. And I'm so thankful he did that. So even though we are paying more
of the
money,
options available,
we picked the best option
Right.
we're allowed to
And so
get. Yeah,
why does a company give certain options?
right,
How does that even get paid for?
right,
Who's involved with these decisions? What does it mean in politics and Congress? How do the insurance companies represent themselves? How do the doctors represent themselves? How do the hospitals represent themselves? All these people are not on the same side.
right,
There's a battle going on, and because of that battle, there's an arms race. Everybody, each of these sides uses tools and builds tools to kind of fight the other side. And every time they fight the other side with electronic medical record systems or ways of doing billing better or ways of trying to put pre-authorization in the way
right,
of you before you
right,
get a test, or ways of denying claims,
right,
or ways of raising drug prices in ways that you don't even know it's happening. All of these tools are at the detriment of you, the patient, and they just make cost happen. They
right,
don't bring any value to you. And so when you give $1 over to the doctor's office, at that point, only 40% of that dollar is even going to your care. Most of it's going to the arms race that's been built. And so we'll talk about that and make it understandable of why these things are happening to you, but also related to your health,
right.
related to what's going on with your thyroid and explaining those issues.
And this is a very big topic right now, and I don't want to get into what happened, but this is in the news right now because of the assassination or the killing, the shooting of the CEO of
Yep.
a health insurance company.
Yep.
And I've been very alarmed at the comments being said. I'm just going to go out there and say that we should not be promoting violence
Hmm.
of any kind. And I think that if we knew more about the person that was murdered, I think it wouldn't be so one-sided of this vigilante Batman type thing.
But it's
It's
also,
but I also get it. I get it. I get it. I
yeah,
get it. People are dying because they can't
yeah.
get their medical things that they have to have a decent life paid for. So I get that side, but on the other hand, we should not do violence. I'm
United
very strong on the don't do violence.
United Healthcare, where the CEO was, and again, violence is not the answer, made $371.6 billion last year.
What?
$371.6 billion, right? That's 371 billion more than everybody was so excited about Kamala Harris raising, right?
Wow.
371x more, right?
That's hard to fathom
That's the
because it's
revenue.
even hard to fathom how much a billion is. A
Yeah.
billion is so much.
And then at the end of the day, in profits, they made about 20 to $30 billion as well, in terms of the money that they can put in their pocket and pay the people that execute that company. That said, they employ 440,000 people. That's 0.1% of the United States population.
Yeah, so a lot of people are employed by healthcare.
And they also pay the health care of many people who need that health care paid.
Right.
But they also deny health care because of the business model that they have.
And is it the business model that we keep hearing? Is this true? The shareholders need to keep making money. You keep paying the people at the top way more than they need to have a decent, like wonderful life. Is that
I
some
think
of the
that
main
word I think
problems?
that word need is where the debate comes from. If
Right.
you're a shareholder, let's talk about Elon Musk. He got an enormous deal of billions of dollars paid to him for a salary at Tesla, and it's being sued for, reviewed for,
Because
but
it's so much.
it's so much, it's crazy, it's more than ever. But the point is that the shareholders say it's worth it. This man is moving our company forward. He's building this empire. Now he's part of the presidential executive branch of the United States. Like maybe it was worth it, say the shareholders, because it's driving it forward
I
in a
mean,
way
he's
that
going
no
to
one
be
else
able
can.
to shape policy probably in the next few years
Right.
for his business, which will also continue to benefit all the other
But then
people that are in those same positions.
if you're someone on the line in at Tesla building a car, are you really wondering,
Is it trickling down to
is it
those
trickling down
people?
to you?
I'm
Are
gonna
you really
guess
getting
probably not.
that in
They're
a
probably not
way?
getting enough And probably like I'm interested to know the people that are designing that tech because it's not Elon Musk. He's not the one coming up with this genius technology. It's other people that he's paying. Are they getting paid adequately?
So there's always two sides to every story. United Healthcare CEO is one of these stories. I myself don't agree with a whole bunch of what's being said about that, about the CEO. That said, I do get it.
I know, I get it
I
too.
get where people are coming from in that they are angry. Because if you are someone that's ever had real problems with an insurance company and couldn't get care for someone that you love or for yourself, and they got hurt, and you see that you think because of the insurance company, um, that's going to make you extremely angry. But where the anger, I think, needs to go is at the system itself, the
Yes.
way that it's built.
I,
And I'd love to talk about that more.
and I just want to say all of the online stuff, because I've seen some of it, of people being like, oh, CEOs are scared and they're changing their system so that they don't get shot, they don't get murdered. I'm just saying right now, that's not how this works.
Mhm.
We're thinking, oh, people are mad. There's going to be real change. No, it's a lot more complicated than that.
Mhm.
And you're going to try to explain it.
Mhm. And
But
what can be done is
violence,
being done.
violence is not going to solve this problem. Us collectively as a country learning more about it and putting pressure on those people that can actually do something about it, like those people in Congress and those people with political power and those insurance companies, putting pressure on them and explaining how they could fix it, mapping it out for them because they might not know.
Right.
Um, that's how we actually get change. And so that's what we're trying to do here at Project Next.
The
Help.
the people who, again, in Congress, that are being put onto the committees that oversee health and that really make health and Medicare and Medicaid go are not health experts.
No,
They don't understand this.
no,
My opponent in my
Conan
last one
definitely
was
does
just
not.
was just put on one of those committees to oversee, and so what does she know about healthcare, right? There's no real. And so what happens is that those politicians who don't know much about healthcare have to listen and learn about that healthcare from somewhere. Where do they learn about it? They learn about it from lobbyists. And those lobbyists are hired by our special interests, by the insurance companies, by the doctors, by the hospitals, by the pharma companies. And those lobbyists go into those offices and tell those politicians everything that they want to hear in the
Oh,
way
yeah.
that's spun in that way, and then they donate.
Yes. And then they,
And then
the
they donate.
politicians do what the lobbyists want.
And then they donate.
Yeah.
I'm a doctor. When I was running for Congress, you might think that the American Medical Association, which I'm a member of, would be enormously behind my campaign.
Yeah. Were they?
Absolutely not.
What?
They decided to, quote unquote, stay out of the campaign and to stay out of this race this year. The reason for that is that one of the doctors in Congress who just retired, his name's Larry Bouchon, is in Indiana, and he just retired. He was a
What?
doctor, and he's a Republican, but
Okay.
he very much was on the side of doctors
Uh-huh.
and helped the American Medical Association with their agenda
Right. That's
and
good.
getting various
And was
things
that good?
call it good or not, but yes, it was good to protect doctors
Right.
and hopefully in that way protect patients.
Right.
So he was a big advocate. He's a Republican in Indiana.
Uh-huh.
And so he obviously puts a good word in for my opponent, who is a Republican in Indiana. And so as a doctor, you would just expect that I would get the support of the doctors' pack, the doctors' lobbyists. And instead, the way of them supporting is by saying, we're going to stay out of this race and not give money to Aaron Houchin or give money to me.
When they clearly should have given it to the doctor that can help make our system better.
And who is trying to advocate for the end users of the healthcare system, the people who use the healthcare system, as in the providers, the patients, the families, Laura's mother, who's in the ICU right now,
I'm so
Laura
sorry.
as a family member in the ICU right by her side. The people who work, those 440K people who work for United Healthcare, not so much the people and the people who are driving the shareholders. the people who are the end users of healthcare who I would like to stand up for. What I just said, should I run again, will make it and be, I'm sure, given to the American Medical Association. They will never support it. And I don't care.
Right. But I mean,
Because
we can call it out. I'm glad you're calling it out because
it's really hard. It's really
most people would just assume you're getting support because you're trying to do a really, really good thing that would benefit
right.
all of America.
And so and I don't blame the AMA actually. I don't blame them. And I don't blame United Healthcare as a business either. What I blame is that we have a really bad system in which people are rewarded and incentivized to game it.
Right, right,
If we had a system in place that there were no rewards for gaming the system,
right,
for going into that office and saying to that congressperson, listen to what I have to say and here's a check,
right.
then we would have a different system and a different way of playing.
If we changed the rules
Mhm.
and made it so people were incentivized for helping human beings, that would change the model, right? If we just rewarded people for doing the right thing instead of rewarding people for making as much money as possible, and it's always about money, 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 these people at the top, greedy, 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 wouldn't that be a simple way to create change?
Yeah, so let's talk about the root foundation of it all.
Okay.
And Beth, I see your statements about the ACA ending,
That's the American Care Act.
Affordable Care
Affordable Care Act.
Um, I'm almost scared to call it this. People call it Obamacare.
Obamacare, yeah.
And they're all of a sudden now the people don't.
Just side note.
Even people that have it and benefit from it in a lot of different ways. One of the ways they benefit from it, let me just say, is that rural healthcare facilities, community health centers, are funded by a mechanism through Obamacare. If you took Obamacare away as a whole, you would have those rural healthcare facilities gone tomorrow, and people would be out of primary care throughout India.
Now we didn't lose it the first time, even though we thought we were. I read Obama's book about his presidency. He's writing another one because he only got halfway through. But in the book, he said in inauguration when he like shook Trump's hand, he said, "Call it Trump Care." And I thought that was genius.
Right.
Obama is a role model of mine. And I thought that was genius. And I wish Trump would have taken that advice because then, sure, praise Trump.
Yeah.
But Americans, regardless of your politics, need Obamacare, Affordable Care Act.
Scared to call it.
And let's change it to Trump Care. Hey,
cares?
Put it out there. Change it to Trump Care. Call it Trump and keep it. But we kept
can
it.
Go into each of the parts.
We kept it the last time, but yeah. What do you think? Do you think we're gonna? Is it unknown? Do you think we're gonna be okay?
I think a lot of what we talk about, it's the same thing as Social Security and Medicare. That if you took Social Security and Medicare away, people would be so angry,
Right.
and you would never reelect people.
Right.
I think the same thing would happen if you took ACA away, but people don't know it yet. If you took the ACA away,
Yeah.
a year or two later, you would be devastated with all the things that went away that you didn't even realize were being funded by it.
But Trump,
and so no one would get reelected.
But
So,
Trump
no, I don't
hopefully
think
he can't get reelected because this is his second term.
Right, but I'm not talking about just him. I'm talking about all the people who lead.
Right, all the
both
people who
parties.
lead. So I get that. So I am also scared of all of these things going away, but they didn't go away last time. So until it becomes a reality, I'm not letting my brain go there because I think life is hard enough as it is right now.
I think the politicians who are in power who talk about the ACA aren't really going to do what they say they're going to do.
I agree.
Because they will not be reelected.
People will be very mad. They don't want the public pressure, and there will be a lot. People didn't like Obamacare.
The insurance companies make a lot of money off.
Oh yeah, so lobbyists. Yeah, you're right.
Money.
You're right.
Money.
So that's sort of positive, I guess.
Laura talks about Medicare Advantage here. It's another thing that we'll talk about of what.
Do you want to ask me about my surgery now?
No, yeah. Let's talk about.
I had it on Thursday, 6 days ago.
So let's talk about your surgery, but I want to frame it a little bit.
Sure, go for it.
So, and the experience with your surgery, how you got there, what happened to get there, the your EKG is one of the things I'd love to talk about,
Oh yeah, that was interesting.
which was done poorly, and so why that was done, how that works. But what I'd like to start again is that healthcare as a system is not broken. It is designed poorly.
Right.
Those two things are different.
Right.
Something that you made that broke, you fix it, and it keeps moving on. We need to change the fundamental design. So let me say, like, what is a not healthcare, but in your life, Sarah, like a product that you love, a thing that you use at home all the
Treadmill.
time? A treadmill. Okay. Which
One of my favorite
treadmill
things.
is one of your favorite things? Why is it your favorite thing?
It's the main way I can relieve my stress,
Mm-hmm.
and it keeps me healthy.
Okay.
And I get to watch whatever I want on TV while I'm running. That's my only time during the day I get to do that.
Okay.
Except for maybe laundry.
Okay. Okay. So it's a normal TV. It's not like one of these that has exercise shows on it. Or
No, it's a TV and a treadmill in my basement, and then I put earbuds on that have silencing things to help the treadmill not be too loud.
So really, so it helps the function of your life through anxiety dissipation, right? Does it work all the time?
No, it broke like a month and a half ago, and my amazing genius husband fixed it.
Okay, someone fixed it.
Yeah.
Did it cost a lot to fix it?
It would have cost a lot more had we hired somebody, but yeah, it cost some money to buy the parts.
Okay. And did you feel like it was a stretch to buy it at all when you bought it?
I think that I always usually get it for like a birthday, Christmas present,
Mm-hmm.
to help pay for it. So usually my parents help.
Mm-hmm.
But yeah, it costs a couple $1,000 or something.
Mm-hmm.
Because we have to get a good one because we both run fast on it almost every day.
But you found a way to buy it.
We found a way to buy it because it's very important to both of us.
Very important to both of you. Okay. So when you think about design and good design of something, it needs to be desirable, feasible, and viable. What does that mean? Desirable. Do you desire this thing?
Yes.
Is it made in such a way that you love it?
Yes.
Is it something that you love? Did this company make something that you love?
So they made a good product. We bought a pretty nice one. I can't remember if it's Gold Gym or something. I can't remember what brand it is, but we bought a decent one.
So it's definitely desirable. Is it feasible? Meaning, does it work?
Most of the time.
Most of the time it works.
Yes.
All right. And when it doesn't work, you can get it fixed.
Yes.
Okay. So
or we get a new one. We either try to fix it, we call the people, and then if it's broke, we get a new one because it's a needed thing.
So it sounds like it could be better if it didn't break all the time.
Yes. So I bet people that have treadmills, it's a common thing. If you're using it a lot, they're only going to last a few years.
So it'd be even better if
it could be better, but I love the treadmill. Yes.
And then is it viable? Meaning, can you afford it? Can you get one in some way? Can lots of people get one? And can the company that made it make money off of it? And both of those things seem to be check. It would be nice if it were more viable for you.
It's hard for some people to get because it's expensive. So I put that aside. Like we have money, we need treadmill. And then, so some people can buy used treadmills, but not everybody can like go and pick them up at somebody's house and bring them to their house because they're heavy. So it's a product that I feel fortunate to be able to get.
Okay. So maybe not the most viable
for everybody.
For everybody. So amazing design of a treadmill, therefore, not only for you, but for the company that made it and for the general population, right? Would be something that company could make a profit off of.
Right.
But most people could afford.
Right.
And if they couldn't afford, there was a mechanism for them to save up for it or pay it in installments.
I'm sure there is. Yep. I'm sure you could do that.
They thought about the way you can pay for it.
So they're going to help you make so many easy payments. Of course, those companies are going to do that.
And then it would be feasible, meaning it works. And so you hit the button and it starts. It's pretty reliable.
Yep, it's pretty reliable.
But sometimes yours doesn't. So a really great designed one would just work all the time.
Right.
Or if it did break down, there's someone on customer service that would come and do it right away.
Yeah.
Like that would be an awesome design.
And I've done that before. I've had my treadmill break one time and I called customer service and I think it was Gold's Gym with that treadmill. And we found out we were under warranty and we got a new motor and they delivered it to us and my husband installed it. And then we had that treadmill for longer.
Great. So it does what it's supposed to do. And it's pretty easy to fix. And then desirable, meaning it helps you in ways that makes you love it, right?
Right.
Including in dealing with stress.
Yeah, because when you run, you get endorphins and it makes you happy. Yeah.
So let's talk about the healthcare system.
Okay.
Um, I am writing a book on the healthcare system
Yeah.
that has a lot to do with a lot of this. And one of the working titles is a healthcare system people love. Making a healthcare system people love. And when you put that into Google, it's never been said before. A healthcare system people love has never been said before. It's an incredible thing to me that it comes up with no matches, right? You might see a couple from when I've written it on the internet.
Yeah.
And so people do not love their healthcare system, is something to say
I'd
there.
love to talk to people from other countries. I just want to do a side note. One of my favorite podcast people is David Farrier, and he is from New Zealand,
Mhm.
and he did a couple episodes about healthcare because he's living in America now, but he's lived his whole life in New Zealand. And in New Zealand, which is a small country, so I think it's easier to get things done, you can have free public insurance, which is not free, their taxes pay for it,
Mhm.
and the insurance is free and takes a little bit longer to get into your doctor.
Yeah.
Or you can pay not very much more to get a better option and you get in quickly. So he pays, I mean, it's like, I think he said somewhere around $30 a month
Yeah.
for the extra better service. And he was having intense back pain. He flew, it was cheaper for him to fly to New Zealand, get it taken care of, and fly home than to get it taken care of in America.
So is that desirable to him? Yes.
Yeah,
Like,
so what's in New
is that
Zealand seems
so?
to be
Is it
much better.
desirable? Is it is it feasible? Can it work? Can New Zealand continue to offer this?
And
And so, what are the problems with that? And honestly, I don't know what the problems, but there might be problems of that system.
And here's what happened. The long story short, it's fascinating. In America, he was told to get back surgery that was going to be very, very expensive.
Hmm.
He takes a plane, goes to New Zealand,
Back surgery.
immediately gets a bunch of treatment. He gets put in therapy.
Yep.
He gets treated like swimming pools, exercises. He
So
gets greatly better, doesn't need back surgery, comes back to America and continues to do the things that they told him to in New Zealand. So that's what happened with his
back
personal
surgery,
story.
and we'll talk about back surgery. Back surgery is a mess here in America. Most people who get it, a lot of people who get it, and I'll get real numbers when we do talk about back surgery in detail,
Oh, that'll be
do
interesting.
not need it. Do not
That
need
makes
it.
sense to me just from
And
listening to
the
Dave Farrier.
outcomes, yep. And the complications are terrible when they happen, right? And it's dangerous for people. You're opening up people's spines. It is dangerous for people, and really
But you know
losing
what?
weight, doing PT, and just
But
pain
you know
control
what I'm guessing?
better.
Therapy and the healthy things that help the patient is not as profitable as back surgery. And I
Exactly.
bet that's a big reason for
Exactly.
it. Yeah.
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 Back
I mean,
surgery,
it's not, I don't think anybody listening to this is shocked that that's the
and that's right.
reason.
And so it's
Because we're seeing
driven.
it. We're literally
Right.
seeing this happening.
Yeah.
So, yeah.
It's driven by that, and it's also just easier for the system to handle. Okay, surgery in, out, right? And then PT,
Long.
diet, and
Right.
exercise
Mhm.
programs, helping people change their life around so that they can be more mobile, getting good lumbar support from their chair at their office. Like, these things
Right. That's smart.
are all things that you could do, but our healthcare system doesn't supply those. We expect people to figure that out on their own.
So I'm thinking in New Zealand, they must be taking some sort of approach where they're trying to better the people that live in New Zealand's life, and that is what they're incentivizing because the program seems to be completely different than what we have in America. But it's like, duh, we want that.
So
We
that's the
want,
incentive. So let's talk
yeah,
about
yeah.
incentives and the American incentives. And this is when it comes really down to how the system is designed.
Okay.
The system is designed on something called the fee for service system.
Okay.
FFS, fee for service, fee for service. It was kind of invented and implemented in the 60s through Medicare, Medicaid, when it was made in the 60s. The fee for service system says there's a book of codes. And in those codes, it says, okay, if I do this lab test, I get paid X amount of money. Nowhere in the book does it say, if you need this lab test and I do it for you, do I get paid? If you don't need this lab test and I do it for
Right.
you, I get paid.
Right.
I get paid as well.
Right.
If I do this test and it leads to 17 other tests that I didn't need, and you got hurt along the way, and at the end of the day, you never really needed it, still get paid for all of that. And I get paid a lot in that situation as a doctor, as a hospital that employs the doctor. All right, that's the foundation of our system, as opposed to something called the value-based care system, which would say if I treat you and I do a great job, I get paid. Maybe I get even bonus.
You get a bonus because you did your job better.
If I treat you and I do a poor job, I don't get paid, or I get paid less.
You get paid less, yeah, right.
Or I treat you and I did it in such a way that I got good outcomes. You're healthy now, and I did it in a way that was cheaper than the average person. Well, maybe I get to keep that.
Right.
I get to keep that money
right.
that I saved.
So if you got
incentivized
incentivized for giving the patient better care, very quickly people would focus their attention on getting the people better care, whether
better
they
care and
have
cost.
We can't expect every single doctor and anesthesiologist and medical person to always put patients first when the program is incentivizing you a different way.
That's right. And so if
Right.
I'm the doctor, what am I going to do? My employer's not going to yell at me for just doing every test under the rainbow. My employer's going to say, go for it.
Yeah, we
Keep
get
doing
more
it.
money.
We're going to do
Get test all the things.
And then we're going to bill the insurance company, or we're going to bill Medicare, or we're going to bill Medicaid. And then what does Medicare and Medicaid or the insurance company do? They say, what did you do all these tests for? I need to put some tools in to stop you from doing
So
this.
they literally say, we won't pay for it.
We won't pay for it.
I didn't know this. This makes sense.
Or we will put in a prior authorization next time.
Right.
So next time you try to do a CAT scan on someone, you got to call us first because you're messing up.
So it's not necessarily that the insurance companies are evil. They're trying to stop the excess spending of money.
That's right.
I mean,
so
we know that they're getting too much money. We get that.
And
but
they exist because of this system.
Right.
If the system didn't work this way, and the incentive was for them to do better outcomes for people, well, maybe they would figure out ways to pay for your transportation to get to the doctor's office to make sure you got there. Because they know when you get there, you're going to get good care rather than the doctor doing a whole bunch of stuff to you. Or maybe they would pay for diet and exercise programs.
Right.
And maybe they would pay for this or that. And those things are
and
called.
Insurance companies are trying to do this. So my insurance company has like an app, and we are paying for a big chunk of our Christmas presents from this app.
Mm-hmm. Go for it.
Because my husband and I we log our steps. We log our steps. We log our sleep. We watch videos on this app. I think it's Virgin Pulse is the app's name. And then we are incentivized a few $100s each.
Mm-hmm.
Like I think we were able to get $500 or $600 at the end of the year because my husband and I are active, healthy people. So it seems like insurance companies are trying. They are giving us money for living a better life, for not smoking, that type of stuff.
Right.
So I can see the insurance companies fighting back.
Mm-hmm.
I wonder how much that's helping.
In a little bit. If the incentives were different and we had different payment mechanisms, and we do have these payment mechanisms. Laura talked about Medicare Advantage there. Medicare Advantage actually is a place where all the experimentation for this new ways of paying things really happens. A lot of the innovations come out of that because they are not beholden by the same rules.
Okay.
That said, they still live off of those rules, the fee-for-service rules, and they wind up doing so many fraudulent things and overbilling in a way Medicare. And we could talk about that and how all that works and just the terribleness of the money that has been stolen from the American taxpayer because of it. At the same time, there are rules in place that allow for experimentation. And I've built programs that have worked with United Healthcare, Humana, Blue Cross Blue Shield, etc., in which we've gotten to change the payment models in such a way that rewarded us for saving money and getting better outcomes. And the whole physician practice that I created around that did so much better. We were never sued over 10 years.
Wow. Okay, my mind's a little bit blown at this first episode, you all. And I'm feeling hopeful because I thought fixing this healthcare system, it was like, it's too hard, we can't do it. But listening to you, you're literally writing a book about this. I'm starting to realize if we all got on board, if we all taught each other these things, um, we could actually do this and it's not that difficult. It's
Yeah.
possible. So I get
So
why you want to have this show. I'm kind of like, oh,
where does the power come from, right? We just talked about power being in the hands of the lobbyists
right,
of these companies.
right.
And the CEO who was killed, who got paid 20 to 30 million dollars a year, and probably had many more incentives beyond that. And so, like, we think the power is there, and every one of us as individual people don't have power. It's true, we don't individually.
Right,
But if we got together,
right,
we would have power.
right.
There's an example I like to use, which might be a little shocking. If the people in America who were dying had a union,
Ooh,
if the people in America who are dying had a union, right? You start dying, you can then get into this
you
union.
got it. You're terminal. You have a terminal illness, or
And
your
now
doctor has said you're terminal,
you're part of the union of dying people.
and then you get this giant amount of support.
And you get this giant amount of support of a whole bunch of people. Now you have all these people who are dying. They cost more than the rest of us,
Right,
right? The end of life
it's expensive.
is very expensive.
Right.
Numbers are all over. What does it really cost? 50% of your healthcare costs over the course of your life, maybe more. Some people say more.
And I wonder how much of that is procedures that they don't need to be doing that's causing them more pain.
Right.
After you explained
Absolutely.
the money thing.
Absolutely.
Mhm.
And people are just not taking the time to slow the care down for a moment and say to those people, do you really want this test? It's actually not going to help you in the long run.
And
do you really want it? Do you
and
want
if
to be
the union like gave you all the information, like if they had research to show you, well, your specific type of terminal illness, this many percentage of people benefited from that procedure and this many, if they could just quickly access it, they didn't have to search if it wasn't hard for people because your life's going to be stressful. You have a terminal illness.
And now you can collectively bargain, right? Where you say to the insurance companies, to the United States healthcare system in any way, hey, we're going to cost you less by having less testing because we're actually going to think about which testing we should use or not, the ones that don't matter. And instead, we want other services from you that help the end of our life, that give me a plane flight for my sister who I need to see from California to come here.
Right.
Pay for that. Don't pay for
and what about
the MRI I don't need.
Treatments that brought care and less pain and comfort to these people,
which are usually
mind blowing. It's like duh, and it's cheaper. Yes, it's
so
cheaper.
The power comes from money, right? It always comes down to money, and people who cost a lot actually have a lot of power if they get together. The problem is they're also the most vulnerable people in our society. So the people who cost a lot are the elderly who are also disabled. And they're not going to be able to fight for themselves as well as a well person that's younger. That's right. And so if we had a way to organize the collective dollars that those people represent and say, I got this big pot of money right now that I know that you're going to spend, American healthcare system. I can make it less, but I want some things in return. I want a better life. I want a better end of life. Right. Which is and I think one of the reasons we don't talk about this more is the fear of death. A lot of people don't want to talk about death. They don't want to realize that it's a reality for all of us. And so it's a hard subject to get people to focus their attention on. So what does Medicare do with the fee-for-service system in this case? Okay. They say, okay, we're going to make a code in this book, and we're going to pay you $76. I don't know what it is today, but it used to be $76 for a half an hour of talking to you about the end of your life and doing what's called an advanced care plan to say, do you really want transfusions anymore of blood? Do you really want... Yeah, these things are hurting you. They're not really benefiting. Do you want intubation? Do you want to prolong your life? Right. These things, right? And it takes time to have those. They're sensitive. And so they give you $76 for them. And for every half an hour over that, they give you another $76. In the meantime, If I just did an MRI on you, I'm going to get thousands of dollars.
Yeah, of course. Yeah.
Right.
I'm seeing this now.
So the fee for service system in no way incentivizes me to slow down. Now I'm a doctor. I really want to slow down. I want to have that conversation with you. What
Yeah.
happens?
You're
My
probably not
boss, the
allowed. Yeah.
hospital,
Right.
says the next month, hey, we've been looking at your numbers and it shows that you spend
Too much time with each
too
of your
much time
patients.
with each of
Right,
these
right, right, right.
patients. That you saw 1.5 less patients on average than the rest of the group.
You better go. You better speed it up.
And we're going to need you to speed that up.
Mhm.
We're going to need you to get your billing up. And what are called RVUs, your units of measurement of how much you're doing up, so that we can actually afford you.
So
We can't afford you doing good care. I'm sorry.
I know lots
They don't
of,
say that.
I don't know lots of good doctors, but I know good doctors. I've got to tell you this story because you don't know this. I used to have a doctor that tried to change the system.
Hmm.
So she tried to start her own practice. She was upset that she couldn't spend enough time with her patients, like you're saying. So she started her own little practice and she got her own little business and it was way far out. I had to drive 40 minutes away, but I would do it. And the first appointment was guaranteed to be at least 30 minutes with her, the
Yep.
doctor. And I went there for a few years until she couldn't afford it anymore and she had to go back into the system.
Hmm.
And she was still, and then I couldn't, like, she had to be something else. So she couldn't be my doctor anymore. But I wanted her as long as possible. She was incredible.
I mean,
And so I imagine she's frustrated like you. And I bet a bunch of doctors are frustrated that they
Absolutely.
can't spend enough time with their patients.
Absolutely.
Yeah.
And nurses who get spread thin.
Oh, yeah.
And we can talk about nursing. Nursing, nurses are the most important part
And they're
of
not
the
getting paid
healthcare
enough.
system
And right. They're not getting treated well enough.
for the desirability part, right? For the making healthcare good experience. They're the most important people. However, they don't have a fee-for-service system. Right?
So they're not profiting off of
there's nothing to say if we do more nursing, we're going to get paid more. If we do more doctoring, if we do more ordering of tests, more radiology, give more drugs, we get paid more. If we give more nursing, we get less because it costs us more without getting any money on top
So
of it.
nurses are incentivized to not spend as much time with the patients?
So the people that hire nurses
Right, but not the nurses.
are incentivized to cut them to the bare minimum.
Right. So if you know a nurse, which I know a few, it's a hard job.
It's a super hard job.
And if you're in the hospital and you watch the nurses, you see all that they have to do.
And if you're a business administrator, if you're running a business and you have costs, you're always looking to cut costs. That's part of business, right? You're looking to bring the cost down to a place where the quality doesn't suffer, right? Where's the lowest I can bring that down? How can I stretch my nurses as thin as possible?
And that's definitely what they're doing right now.
And if you're a business person, you look at the doctors, they're the revenue side. They're the people who are making money. So you say, how can I get those doctors to see as many patients as possible? And I'll have more doctors if I need them, if the volume's there, if I can see people with it. Right. And you have those people and you kind of push them as hard as possible to see as many people as quickly as possible. And that's why doctors only spend a minute with you. A doctor, how long do you think, on average, a doctor listens after they say to you, what brings you in today, before they speak?
I don't know. I can't. 30 seconds, a minute. I don't know. What is it? Do you know?
It's about 5 seconds.
Oh my gosh.
4 seconds, 8 seconds.
So
different studies.
So I know that doctors are busy. I know this already, that doctors don't get to spend enough time with their patients because of my own experience with my own doctor that tried to buck the system and it didn't work. So when I have a doctor come to me, if it's about my parent or my mother-in-law or me or my kids, I spend a lot of time thinking exactly what to say at the beginning to get their attention so they listen. And then I plan out in my head the best way to reach them. And since I've been doing this the last few years, I've seen it benefiting my loved ones.
Mm-hmm.
Yeah. So I mean, because we have to figure out the system.
So, and we'll talk about in this show, there's a lot of change going to happen. RFK is coming on as the head of healthcare for the United States. And Dr. Oz is coming on to run Medicare. Uh, both of those. Dr. Oz talks about value-based care all the time,
Huh.
right? And so how he's going to do it is interesting.
Do you
Let's
think
see.
that he could bring some positive change,
I think
possibly?
these people are disruptors. I think they're disruptors.
Yeah.
And although I strongly disagree with a lot of the stuff that's being said, I also, because I look at and read and am in the, the policy wonky details of it, I see some really good stuff they're saying that I agree with.
So that's
And that
interesting.
it's stuff that no one else is willing to say.
I know that we're all very fearful, or a lot of us that are paying attention are fearful of these changes. So I'm kind of looking forward to this show because as it's happening, you can explain it to us
Yep.
because you know so much about it.
Yep.
And this is always going to be free for you guys. This show, are we going to try to do? We'll try to do weekly, I think, right?
Yep.
And so stay with us. This can be a way that you don't need to be fearful or have anxiety. It's going to be an open, honest conversation. And it's also not partisan, it's people based. We
Yep.
want to make your life better. That's our mission statement. We want to make your life better. So we're not choosing a side. So the fact that you're saying maybe these disruptors could possibly do something that helps us gives me some hope. And if it's not going to help us, you'll tell us and
Yep.
we'll know instead of reading the scary headlines from the media companies that are profiting off of our anxiety and fear. You can hear it from somebody who actually gets it. And then me who doesn't get it, I can ask if I don't understand it, or whoever else is on can explain it. So
So let me tell you. So
I have
first
more
of all,
hope. That's what I'm saying. I have more
Angela,
hope.
Angela, I love what you're saying here. You're building a coder. You understand these units that people use to say, okay, the more of it I do, the more of it these doctors do, the more I can bill. And I love this idea that you refuse to submit a claim to the insurance company on behalf of your employer because you didn't want your name on it. I'm sure someone else submitted it, but good for you for standing up.
Yeah, good
Good for
job.
you for saying it. And this is how change starts, right? And
Hmm.
this is the change we
And
need.
the fact that you're saying it right now, you're calling it out, that's huge because we just need more people to do this.
And so people understanding it. And it also empowers that person, you, when you start getting bills to say, what did I really need this test? I don't want to pay for it.
Uh,
I don't want to even, I don't want my insurance company to pay for it. I'd rather pay for something else. And so you get caught up in who's the good guy, who's the bad guy. And there's a lot of finger pointing, but my point is that neither is the good guy or bad guy, that the bad guy is the actual foundational way it's designed. And that's what we need to change. So RFK recently said, what if we stop the AMA, American Medical Association, who didn't support me, right? And so
could be better, AMA. Could be better.
yeah.
Just saying it. Just throwing it out there.
um I'm sure they'll never support me again. So after this,
I mean, come on.
I'm gonna have to.
We'll publicly get on and say how great you are.
They can
If
get
you want to support the better person, I can change my opinion.
they can give $5,000 to me, and I'm sure they'll give me zero next time if I run. So I'll be looking to people to help.
Yeah, the
So
people.
the AMA, RK said to the AMA, I think we should stop having you be the people that makes the fee for service system, because the AMA, the doctors, are the people that make the codes every year. They publish every year what the codes are that are going to be used. Congress then, and they recommend what the price on those codes should be. Congress then says, okay, we'll approve that these codes are the codes that we'll do. They do that in a way by it's complicated, but they pass a budget, and then the head of healthcare, who's RFK, says, okay, we're gonna use these codes in certain ways. But they originate, the people who are writing them down, the people who own the process in the beginning of it, suggesting is the AMA. So the people who are
So they have a lot of power.
they have a ton of power. And it is part of the fee for service system. So RFK is saying that doesn't make sense. We shouldn't have the people who use the codes making
Who
the
make
codes.
money off of the codes. We shouldn't have them making the codes because they're going to make codes so they can make more money.
That said, what I'm scared of is that if you abolish that, but don't put the insurance companies in their place, the insurance companies are just going to take advantage of that.
Oh.
And so, hey, RFK, I love that comment. I love that thought of like, hey, we should do something about that. But what is the check that's going to happen on the insurance companies and the pharma companies and others? And so, really, the insurance companies in this case. And so the point is United Healthcare going to come in with a check and another check and another check and say, "Hey, abolish AMA and what they do, but leave us alone. We'll get it. We'll
I
make our money."
imagine that's what they're going to do. I mean,
And most of the top lobbying companies, the most of the top lobbying firms, PACs, in terms of what they give are healthcare. I used to have this number, but it's almost half of them of the top 20 are healthcare.
it's interesting.
So who are given the money? Because it's 20% of our budget. It's enormous part of the how the money
So
works here.
we could focus on people. We could change the incentives. We could save a bunch of money, but we need smart people and empathetic people and medically intelligent people to be in charge of these decisions. I fear that we don't always have the best people that are in charge of this enormous amount of power making these decisions. But I do see that if it is a very public story, like it is in the news right now, if it is very publicly driven, we should focus on the patients and making their lives better. We should incentivize everybody involved. They should get paid better for delivering a better product, the human life getting better.
And so not just the patients, but what I always use is the end users, the people who are using the system. So it's the
Right.
patients, the families, the doctors,
Right,
the
everybody.
nurses.
So everybody should be
Angela
having a
has
better product.
medical billing encoder.
Right.
So she's not put in a amoral position of dropping a
Yeah,
bill
she
to an
shouldn't
insurance
have to
company
do that.
or to Medicare that doesn't,
Right.
right? These are the people who get caught up in the system or are being used.
Right.
The 440,000 people who work for United Healthcare. These are the people that need help and need us to be talking about for them and with them and organizing them because once they organize they have power, and right now they are
Okay.
people are scattered.
I have one question and one big question I want to end on because I want to talk about it next time if you're
Sure.
game for it.
Sure.
Okay, so just to talk about my EKG. So before my surgery, I had surgery last Thursday. The Monday before, or no, the week before, the Tuesday before, I had to get an EKG and more blood work to prep for the surgery, which I'm thankful for. They wanted to get a bunch of research about me before I had this surgery. So I go for my EKG and my blood test, and then a couple days later, it comes back that my EKG didn't look good, and the anesthesiologist ordered for me to go to a cardiologist to make sure my heart was okay. And I'm already pretty stressed out about the possibility that I probably have thyroid cancer. And so I had to go that Monday. So my husband thankfully took off part of his work day to drive me because that's always stressful to go far away to a new building and find the medical building that I'm supposed to be in. So he helped me with that. I get there and I meet the cardiologist and she does a bunch of tests on me and I'm trying to find out is something wrong with my heart too? I mean, I'm an active person, but I'm trying not to stress about it. And she does a bunch of tests and she goes, it looks like they did the EKG wrong and they put the sensors on backwards. Your heart's fine. I'm wondering, is that person going to be told that? Is there any incentive to make sure that the person that did it, that was a lovely person, I'm not saying people don't make mistakes. I'm just wondering, is there any setup in the system so that maybe the person is told, hey, just to let you know, the sensors got crossed. Maybe double check next time. Is that going to happen?
Maybe, barely, probably not. So
Yeah.
how much did they get for doing an EKG? Probably somewhere between $15 and $100, depending
I
on
haven't gotten that bill yet.
what their insurance, depending on how they work with the insurance company. They did it wrong. There is no incentives to say you did it wrong. We shouldn't bill for it.
Yeah, I'm gonna have to pay for that.
You're still gonna have to pay for it. And when you get the bill, you should call them up and say, "I don't want to pay for this. You did it wrong."
Okay, so I should try to do
But
that.
guess
Okay.
what? You don't have time for that.
Right, I'm pretty
And they're
busy.
banking on you not having time for it.
Right.
And there's no incentive. So the incentive instead is, I'm not even going to look at an EKG, which I can tell you if you gave me that EKG, I would have told you they put the sensors on wrong. It's very easy to see. Very easy. So no one looked at it. The doctor didn't look at it. No one. They said, oh, the EKG's messed up. Sarah should go to a cardiologist. They pressed the button, referred you to a cardiologist. Now you go to a cardiologist, you get billed again for that visit.
Right. I'm gonna have to pay for that.
$300-400 maybe for that visit. And then they did another EKG maybe, or they did whatever testing it is, and you get billed more and more and more, and you still needed that EKG.
Yeah,
So
I
you
wanted to
still
make
need the
sure that my
EKG,
heart was okay.
right?
Yeah.
And so they needed to know your heart was okay, especially you had thyroid problem. They needed to know that your thyroid can affect your heart. It hasn't affected yours.
Oh, okay.
And so they needed to know that before they did the surgery. But then they did a second EKG. They're going to bill $50 to $100 for it, and you have to pay for both of them because there was no incentive to say if you spend less, doctors, and do a better job and give you not only better
You get a little
care
more.
but better experience.
Right.
There's no 5-star rating going on
Right.
to get a better experience. Do they care? And so for you to get a better experience, they would say, hold on, let me take a moment and look at these EKG. Oh, it's not, the sensors aren't right. Just do it again.
And don't
charge
charge her. Don't charge me. Yeah.
That is
But I just want to say everything was good with my experience except for the EKG. Everything else was good.
Your experience could have been so much better. As you tell me about how
Yeah,
great your experience is,
you
I
have
hear
heard
it
all of
each
my
time,
stuff. I have explained it to you.
and you're being positive and you're going through it, and you're finding buoyancy from yourself and from your husband and from the people around you to keep you
And
up
you,
for this.
I literally have a friend that's a medical doctor that's willing to talk to me about any of my stuff, which has been so nice.
And I don't want to like break you when you tell me about an experience and say, oh, it could have been better, right? But almost every step of the way, it could have been better.
So another thing that happened,
if the incentives were right, if the fee-for-service system weren't what's driving
and
everything
my
happening.
doctor, I have a good doctor, and he told me if I didn't get scheduled for a biopsy in a week to follow up and make sure I got one. Well, I didn't get scheduled in a week, so I followed up, and and after like 5-10 minutes of going to different people, I got a hold of the scheduler that's supposed to schedule my biopsy, and she goes, we're missing something from your doctor's office. They didn't put where you got your ultrasound. And I'm like, well, I got it at priority radiology. And so then they wrote that down. They go, okay, now I can schedule you. So I had to be in charge of my own scheduling of the biopsy.
Yeah, no one's coordinating that care.
So
So
there was something missing there. So those are the two things that I think could have been better for me personally.
Talk about coordination of care.
Okay,
and
we can talk about it later.
Angela, I'd love to talk to you about this. It sounds like your husband had an EKG problem as well. The premise of this show is to interview everyday normal people. And Angela, if you want to be the next person or one of the next
message
people,
us or something.
Message us, and,
yes,
and we'll be happy to talk about it, and to talk about how they go through it. We spent a lot of time today talking about foundational systems, talking about things going on in the news around United Healthcare. We'll do that as well with someone here. We would definitely get deeper into
right.
We've already talked.
I have a topic I want to do. I'm trying to close this at 60 minutes so that I don't know what happens when Instagram goes over 60, but you're not allowed to.
All right.
I don't know whether it kicks all of us off or just Instagram. Yeah. But okay. I want to talk about this sometime. Have you heard the story about the Anesthesiologists Association? Have you heard this story?
Which one are you talking about? The Anthem Blue Cross Blue Shield stuff?
Maybe. I don't know enough about it. I just know I want to talk about it. Have you all heard about this story where people freaked out online because anesthesiologists threw a big fit that they were being attacked by insurance companies? And then when you looked into it, it was actually the fact that anesthesiologists are booking way too many, not every anesthesiologist, but some anesthesiologists are booking like a 4-hour surgery as an 8-hour surgery.
That's right.
And all insurance companies wanted to do was do like a double check. Hey, this surgery is supposed to be 4. You clocked it as 8. We need one more step of accountability to make sure it was actually 8 before we give you the money for 8 hours. And they threw the biggest fit, and everybody was all upset because it's so easy to blame insurance companies.
That's right. And it was during this whole thing with the United Healthcare, right? So
it came out at the right time.
At the right time.
Yeah,
so
yeah.
That's what I'm saying. And so don't cry for the insurance company.
Right.
Say that they were all good on this one.
Right.
Right. And whoever's going to control the narrative, right, and say,
so I'm sure
but it's true.
Right.
But again, because of the systems in place, this is the arms race that I'm talking about. These are the tools that I'm talking about, that the anesthesiologists are using a tool of, okay, If it goes 4 hours and 1 minute, so I'm gonna bill 8 hours or whatever it might be, right? And they're using this tool of you playing the game
to make
be
more
able
money.
to
They're
make more
profiting. They're
money.
playing the game to make the money. If we change the game, so they couldn't do that.
And the insurance company is like, well, we're gonna have a system where we say to you, you're gonna have to pass every surgery by us before you do it. And they're like, what? You can't look over our shoulder every time. We're
So
done.
I see both
We
sides.
we need to do this, right? And so they say, well, you have to pre-authorize it with us. And they're like, that's terrible for the patients to do pre-authorization. What if it takes a long time and they need the surgery
So it would
today?
take surgery longer, and they need to be in surgery as soon as possible.
Right. And so it causes problem. And who loses at the end? The patient, the end user, the people at the end. Because the system is incentivized for all of these businesses, as well as Medicare, who, hey, everybody, Medicare outsources all this stuff to private businesses. All the payment stuff is not some government employee doing it. It is a insurance company or a private business that they outsource. We contract for all the functional payment stuff with third-party businesses in the United States from Medicare. It's not Medicare doing it itself. Okay, so there's
So
a whole nother thing there.
there's just so many easy things, really, that we could do to make things cheaper, right? I mean, that's pretty much what you're saying. We could fix this. It's never going to be perfect. Nobody's ever going to get absolute perfect care because every human being is different. But there are simple things we can do
Yeah,
to make things so much better.
right. And it gets back to RFK saying AMA shouldn't put the codes out there. Is that really going to be the solution? Probably not exactly that, but it's the kind of thing that needs to be said to call out, like, hey, everybody, did you know that this system is happening right now? Because the average American person doesn't. And he doesn't seem to be scared to say that stuff.
So those of you that have anxiety about the future with our medical system, tune in to Project Next Dr. Tim, because he is going to be explaining all of this to him. I feel so fortunate that he's my friend. Not only do I get to do the show with him, but that he's my friend, because I can tell you really want to get this out to the country, and we want to push this out. The more people that watch, the more people that follow, that share, that tell their neighbor, you listen to us, you explain it and explain it to them. Here's what we need to do. The more we can get this out to Americans, and start calling for it publicly, the greater the chance we have of actually making some positive change.
I want to be a voice for these end users, for the patients, for the families, for the doctors, for the nurses, for the people, the billing people who are doing all this. That's the voice that I want to bring to the country, whether I do that through advocacy in DC, whether I do that as a congressperson in DC, whether I do that right here on Project Next Media. It doesn't matter.
You're probably gonna do it everywhere, is my guess.
We're going to do
You're
it
gonna
in
everywhere.
every single, whether we publish this book that we're going to publish around this and get in some trouble with some of these people, which
Good
could be
trouble.
interesting, good trouble with these people. It just needs to be said.
I want to do, it can be on this show or it could be on my show. I want to do an episode with you where I interview you and find out your life as an ER doctor, and just how you mentally handle everything, because you're one of the most mentally strong people I know, and I learn stuff from you.
Thanks.
Um,
Internally, it doesn't feel that way all the time.
Me too. Like I feel like I'm a strong person, but I'm like, I don't know, am I? I feel like the country could benefit from hearing from an ER doctor and someone that runs for Congress. And like, it's interesting knowing you and learning about you and seeing that you care deeply about everybody in the country, which is so refreshing. And you're like working on this how do I help as many people as possible? And that's one of the reasons we're doing Project Next. I would like to know your tips, and I think that would help the country. So I think that'd be pretty interesting. Interview you, and you openly, honestly give us your best tips for handling really stressful situations. What do you think?
Sure.
You will
Happy
do
to
that?
do it.
Yeah.
I mean,
I think that sounds fun.
Each specialty in medicine attracts a certain type of person, and emergency medicine usually attracts people who are either adrenaline junkies because of the craziness of it all, or people who like to have a whole lot of things coming at them at once.
I'm
and
like
be
that.
done with it.
I'm that second thing. I like a lot of things at once. Which one are you? Are you anxiety junkie or the second one?
No, second one.
Yeah, we have that in common. This is one of the reasons why I think we decided to do a company together. We have that in common. That's interesting. I've met quite a few anxiety junkies, and I get real anxious, like running for state house and stuff. You meet them, and you're like, and then I'm like, no, I gotta calm down now. This isn't good for my heart. Do you get that way?
That's why you have the EKG. Your heart's fine.
My heart's fine. I didn't know for a little while, a few days there.
All right, Angela, reach out to us.
Yes.
Thank you, everybody.
Thank you, guys. I'm going to turn on the music, and then I want to thank a couple people. I want to thank, hang on. Oh, wait, how do I get it to scroll down? Oh, there it is. I want to thank, is it working? It's too quiet. Is it working? There we go. I want to thank Ellen, who is letting us use her beautiful studio. And it's sort of in the middle of where we live.
You think she's on the other side of that door listening to this?
She's watching us over there. 100% support. I am going to go ahead and shout it out. She also helped get StreamYard, so love you. Thank you, Ellen. And
made this music.
I want to thank my husband, Chris Blessing, who made this music.
Hey, Ellen.
You should get in and say hi. You should come in and say hi. Come and wave behind us. This is Ellen. She's adorable. I love her so much.
Studio manager.
We love you, Ellen. She's gonna be on the show soon. I'm excited about it. So thank my husband for the music. I want to thank Karen and Scott for doing this. I want to thank Vicky Tincher for helping us set up the business. Anybody you want to shout out?
My wife, for sure.
Your wife's awesome. I love her so much. Missy, love you.
Putting so much behind this, and I got to play with Cass a little bit. I was late to this, and I said I was going to be late.
It's fine because I just set all this up.
Because I got to play with my son just a little bit extra.
He's a cutie pie. He's cute. I want to say I am proud of myself because I'm figuring out how to do all this stuff, and it's hard.
It is hard.
So
it is hard.
I'm not a tech person, but I'm an intelligent, hardworking person. So I'll just go keep at it. Yeah.
And we are, getting this business together. One of the things why I know so much about this world is not because I'm a doctor. Doctors, again, are the end users of this. You know some of it and how it works, but it's because I make disruptive businesses that try to change health.
Which is fun.
Project Next is just one of them. And so we've made really big businesses that have helped millions of people. And this is going to be another one. And so if you're interested in getting involved in some way, if you want to be on the show, Dr. Tim, if you want to invest in this company, however, get in touch with us.
And please share our stuff. Please subscribe on YouTube. I just got us on X, Twitter.
Nice.
It's Project Next 25.
Perfect. And one more thing before we go. Happy birthday.
Oh, yeah, thanks. 44 today, you guys. And I wanted to thank Tim for starting this company with me. I kind of am still in shock that you are doing this with me. It's literally a dream come true. And
so I predict in about a month or so, maybe a little bit more, we'll have a full platform, a full slate of shows, programming, scheduling, internet presence, website presence,
working on it.
Newsletter.
Working on it. We're cranking it out.
Different ways to get involved and be part of the message and the movement.
Do you know what Corinne and I are talking about tomorrow at 9:30 in the morning?
That's gonna be fun.
We're unveiling our first.
That's an early time to do that.
I know. I have therapy at 11. We had to get it early.
It's good timing.
We are unveiling our new show. Corinne thought of the title. She's genius. It is Project Next: Plots in Politics. And we're stirring up some good trouble tomorrow because we are talking about all the many sexual assault allegations that have been made about our upcoming Democrat Senate Minority Leader, Greg Taylor.
Yeah.
And we are going to talk about that. And
it's super important to hold people on every side of the aisle accountable, and that's part of what we're going to be doing here.
Let's make some good change.
Let me tell you, the scariest thing of this today was talking about the AMA and the way I did.
I'm proud of you. I'm sorry. I said hey, I'm calling you out, and you're like, don't call him out.
I couldn't put that genie back in the bottle. Oh man.
I'm proud of you. That's what we're doing at Project Next. We are going to make the country better by uniting with everybody, and also we have love and empathy for everyone. it doesn't matter whether you think the same as us or not. We care about you and we want to make your life better.
Yeah, the media that you have right now is just trying to
Divide.
prey on you to
Ugh.
have as much fear and hate and anxiety and then divide us. And it's artificial divide. We don't have to be divided.
We do not. And we're not. If you actually go out there and talk to people, we're not. We're going through the whole song.
Yes.
Okay. All right. Bye, you guys. Love you all. Thank you so much for watching. Share, share, share. Please. I'm sorry. I'm always asking you that, but you guys are awesome. Bye.
Thanks. Bye.
Oh, it starts again. That's good.